what we're going to do here is we're going to just get some improvement in the temple. So this one's a little bit weird, but it feels a bit squelchy, but we'll go nice and gently. So I'll get you just open your mouth about 1/2 inch, lovely. And what that does is it just relaxes the muscle here. And then this is alcohol, it doesn't smell very nice. And then what I'm going to do is just touch your eyelid, and then I'm just going to hold that. So what you'll feel is you'll feel a little sharp pinch coming up. So sharp pinch now, 1, 2, 3, well done. What I'm doing here is I'm putting in about 1/10 of a teaspoon in total in tiny little doses. And I'm really just depositing this filler really nice and clean and safe in what we call the temporal fossa. So what I'm going to do now is just slowly take this out, and then I'm just going to press on it. Well done. We'll be making a pinch here in the cheek, and this one's quite a pinch, okay? Okay. So if you're ready, 1, 2, 3, pinch. Well done, Orla. And then I'm just going to give that a little wiggle, and we take that out. And then the cannula goes in with a little pop, so it's not very pleasant. Well done. And as soon as that's in, I want to really create a beautiful layer under here. So we're going to fan the product out. And really what we want is to get a lift. So you'll feel this, it pops and squelches a little bit, and it's not very pleasant, but you're doing great. And then I'm just going to work my way up the cheek. What I'm doing here is just putting in a little under blanket of support, and you'll feel it kind of popping and squelching a little bit. So you're doing great. And then we're not adding anything to your mid face because you've beautiful cheeks as they are. And the worst thing I could do is give you too full a cheek, and then it looks more obvious. Whereas as it stands, it's beautiful and we want to keep it. Again, it feels a bit weird under the skin, and I'm just nudging that in a little bit. Well done. And I'm going to take that out slowly. Great. And then you can have a peek in the mirror again. So really what we're doing is just starting to get that lifted
Contour,
up.
yeah.
Isn't that beautiful?
Yes.
Because this is more aptly, and now this is beginning to just marry here. Isn't that really cool?
Yeah, it's cool.
Yeah. 1, 2, 3. Well done, Orla. I'll give it a wiggle. And then I'm going to pop the cannula in. And then this goes in with a little pop. Well done. Now I'm going to come across. The chin is a little more sensitive, so we'll go in little tiny steps. And you can get almost like a little jolt of discomfort because we touch tiny nerves. So you're doing great. And again, I'm just laying this product down very gently. So I'm under the skin. I'm on top of the little muscles. And you'll feel it popping a little bit because they're tiny little muscle fibers that are coming from your chin, from the bone, and coming up into the skin. So you're doing great. And then because I'm treating the chin, there's tiny little nerves that also supply the lip. So your bottom lip will feel a bit numb, but we're not putting anything in the lip. And then you'll feel this pushing a little bit. So there's a bit of resistance because we have these small ligaments, and they're essentially stopping the face sliding down. And then I'm going to come up here and just help support the corner of the mouth. So this is a little bit sensitive, but you're doing brilliantly. And then the numbing starts straight away in the product, and it lasts a few hours. So when you go out of here, you'll feel like you've been at the dentist. And again, you'll feel these little pops of resistance. Well done. And we take that out nice and slowly. Nice, isn't it?
Yeah, it's lovely and soft though. It's like just got rid of that kind of, you know, the hangy.
Yeah.
Yeah.
So to me now, you've just got a very softened shape. Nothing crazy. We didn't give you big chubby cheeks because they're already beautifully natural, and we want to keep those, so they're great. But by filling the temples, we've softened that divide a little bit. And instead of a hill and a valley, a hill, it's now just it's more of a curve. Yeah. You did really well, and then the skin is red for about an hour afterwards. And that's because we've been manipulating underneath the skin. You don't need to massage this at all. We massage it and just make sure it's all really smooth. You look great overall, and we're not trying to change how somebody looks. We're just trying to soften and improve. What do you think of
I'm
that?
absolutely delighted, and the fact that you can instantly see it makes actually the skin texture look better, doesn't it?
It does, and we'll give you a hand gel in a minute and you can have a little feel around, but definitely that texture is stronger because we've put in almost like an under blanket of product to give you more support.
Yeah.
And you'll feel and see it look stronger, and then over the coming months that'll build collagen and it'll just get stronger and stronger.
I love the way it works over time.
Yeah.
And it's like a gift that keeps on giving.
Yeah, absolutely. And you know, we don't want drastic changes. I'm a good bit older than you, but we just want something really elegant and subtle and that fits what is the essence of you. Hopefully it wasn't too sore.
No, it was actually okay.
Yeah.
It was a little tiny bit of discomfort, but no, it was absolutely fine.
Well, you did great as well, yeah.